Welcome back to Faunteeshow, where we are at the center of the busy Cavendish Square in London, and I'm here at the Royal College of Nursing to speak to Donna Kinnair. And this is a woman who has climbed from the lowest of her profession to become the top woman in the job. Come with me. Good evening, my dame. Donna, good evening.
Good evening.
It's nice to have you on my show, Faunteeshow, for C-Hub magazine. And today I want to go through your work, so that people will get to understand the amount of contributions that you are making behind the scene. And I'm so glad to have you today.
Thank you.
So, as a leader in the nursing, what has been your most challenging experience?
I guess for me, probably to get into nursing was quite a challenging experience because even though I didn't start nursing until 1983, at the time I started nursing, I had a young child. Oh. And in those days, they didn't allow you to be a nurse if they knew that you had a young child. And equally, in those days, they always tried to push you to be we used to have two types of nursing, a state enrolled nurse or we had a state registered nurse. And it felt to me as though when I turned up for my interview, despite having masses of qualifications, that they were pushing us into being a lower grade of nurse. So for me, I was probably the second. My sister was the first black nurse that was taken into a particular large hospital in London, and I was the second. So it was still a battle in 1980. 1981, 1982. Now, it wasn't that all hospitals it was a battle, but for large teaching hospitals in London, it was a real battle for ethnic minority groups to become state registered nurses. So I always feel like it was a privilege, and I think I only got there because my sister warned me about some of the things that I would have to know about.
So you were really equipped by your sister's advice and all that. Okay, so why did you decide to be a nurse?
Well, I didn't initially. I guess as a young child, my father had a lot of interactions with hospital, and I guess one of my earliest memories is as a child I had a really bad kidney infection, a kidney reaction to chicken pox. And I guess one of my earliest memories is being behind glass where people were, I guess, keeping you free from contamination as a young child. So I think that's always stayed with me, and my dad was a chronic asthmatic and so ended up a lot of times in hospital. And I guess many doctors at that time were men, and so you didn't really see a lot of female doctors. So I guess it was quite a natural thing for me to think about becoming a nurse just because of the environment that I grew up in. Although there wasn't a nurse, my mother was not a nurse, but many of my aunts were nurses. So they had come to England to study nursing. So many of them had paved the way in terms of listening to their experiences. But I think for me, I hadn't probably as I got older, thought about being a nurse as much because I lost my brother when I was 14. And I just thought I didn't really want to be around dying people. And academically, I was probably quite bright at school. So when I said I wanted to be a nurse, they were like, oh no, you've got to go to university. So actually I did. I started studying maths, and it was after that I decided no, I really did want to be a nurse because it was more suited to my personality.
But now, do you find that fulfillment in nursing? Do you feel fulfilled being a nurse?
So I think I've had the best career ever because I think as a nurse, as you know, when I trained as a nurse, you could experience many, many fields of nursing. So I have worked in intensive care, in children's, I have worked on the edge of nursing with children in need of protection. I have done so many fields of nursing, practice nursing, health visiting with babies, all sorts of types of nursing that have really kept me stimulated. It has really made me think differently about working with different types of people, understanding parenting, looking at social policy, looking at inequalities in health. So for somebody that likes studying, that likes clinical skills and that likes to be very practical, it's a really ideal profession.
Oh. Having climbed and gone through the the NHS and climbing the ladder as a nurse and all that, when you hear the word diversity, inclusion and all that, what does that mean to you? How do you see it from the perspective of NHS and the nursing profession in this country? How do you feel?
So I feel that if you're
without being political.
No, I feel that if you think about diversity in nursing, we have a diverse nursing workforce, and there are many nurses of colour of all different types, and nursing is a profession that you don't have to be the most cleverest person in the world to do nursing, but it is something where you can use observation skills, clinical skills, and you can use intelligence in terms of analysing things. So it caters for a whole range of people. So I guess for me, when I think about it, we've got a lot of nurses of all different types, but we do have, I believe in nursing, a ceiling. And part of it isn't because of capability, or isn't because we haven't got enough nurses who are from from different countries able to do leadership in nursing. But we do have a system that you are judged by how you are, what you look like, and breaking that ceiling is quite difficult for nurses.
And you've broken it?
I wouldn't say entirely, but I think it has been easier, I guess, for me than I have seen. I'm not a special nurse by any means. There are lots of nurses that are equally as capable as I am. And I guess what I've seen is that to be able to do that, you have to facilitate people doing that. So a good part of my career has been mentoring others and supporting others on that journey. So I think that it could be much more diverse at the top. I think some of the institutions, the NHS, there are many people in there that have a vested interest in not allowing it to be as diverse. We know that good outcomes come if you've got a diverse population, then the diversity of the workforce meeting the needs of that population is better for them. But we haven't quite broken the ceiling to make sure that we've got inclusion and diversity at every level of nursing.
How much has nursing evolved since you became a nurse?
So I believe it has evolved in many different ways. I think there is some involvement, and there's some things I think that we've gone backwards on. So for me, the education of a nurse has evolved to include so many skills, other skills than just clinical knowledge and anatomy and physiology and the maths about drugs calculations. We've got nurses that are actual leaders, that we have got research papers that nurses are conducting. I think we have led the way on many of the improvements. So if I look back in my life, a lot of the child protection issues that we used to come across, I can remember being a nurse in theatre and a child coming in with gross head injuries, and at that time we couldn't prosecute anyone because we didn't know who inflicted the injury, and therefore even though both of the perpetrators and the parents may have been standing there, we couldn't do anything about it. But actually we have got so much better at assessing families, looking at children, and though we still hear the bad stories, because it's the bad stories that make the news, isn't it?
There's a saying, mostly in Nigeria, where when I used to practice nursing myself, it goes like this, that when a hospital is good, has a good reputation, doctors get the credit. But once the hospital gets bad, or there's a bad news in the hospital, nurses get the blame. What's your reaction to that saying?
I guess nurses deliver the care on a day-to-day basis. So the experience of the patient is closely connected to the care that a nurse delivers. If you think about whether you're in A&E or whether you're most places in a hospital, a doctor is a visitor to a patient for a few moments to ask a few questions and perhaps, but most of the other time the care is being delivered by nurses. So I think intrinsically linked is the quality of nursing to the patient experience, because we showcase care, don't we, and compassion and empathy. So I do think that when a hospital is good, doctors may get that reputation, but to be honest, doctors diagnose and then disappear, don't they? And in fact, even when they're diagnosing, it takes a good ward sister for a junior doctor to sometimes get to the right diagnosis, as I remember in my day. So I wouldn't accept that expression. I would say that both doctors and nurses contribute to the effectiveness of a hospital, because actually if you've got a rude doctor that hasn't bothered to listen to a patient, their impression of that hospital is equally as negative. It is true that they are held up by patients,
the society,
or by society even, as this almost mini god. In some cultures, it's not so much here, but I guess in some countries, when I worked in the Caribbean, for instance, they are held up as masterful, and the people will revere them. Nursing, not so much, because we get alongside the patient, with the patient, and actually help that patient through that particular problem. And I guess that's why people will say that is actually the your care is as good as the last nurse that you spoke to. But I think both doctors and nurses are responsible for care, because a flippant doctor that hasn't bothered to listen to a patient's needs is actually just as bad and impacts on that patient's experience in the same way as a flippant nurse would.
Exactly. You advised the Prime Minister's Commission on the future of nursing. Where do you see nursing in the next 10 years? Where is it going to? Where is the profession going to?
So I think it's important for us to, as nurse leaders, to make sure that the profession is guided. For me, it's really important at my stage in my career that I leave a legacy for nursing, because I think that we have had so many changes in nursing education, nursing funding, all of those things imposed on the profession by others, that for those that actually have the knowledge of how to get a good nurse, it's important that we leave that legacy and we try and steer nursing through the difficulties that it faces. I think what I do know is that we will always need nurses. So irrespective of what government or other people do to the profession, they will always be required to deliver care until we rule out sickness and death, and we can't really do that. So we're always going to be needed. The way in which we guide our profession and encourage people to come into the profession, and actually tell our colleagues, brothers, sisters, everybody, how important a profession it is what will keep it going. Because it's not automatic, it's a hard job. Anybody that has ever come through the ranks of nursing know that night duty, all those things, whether you're on a midwifery unit, and it is hard work. But it's up to us in the profession at the moment to actually highlight the importance of it and the importance of the good qualities that you need to come, and attributes that you have to be a nurse, and actually promote that going forward, because it is very easy to see some of the basic fundamentals of care as not as important as a lawyer or a doctor. But without it, we don't have a society. If we don't have midwives to deliver babies safely, how are babies going to be delivered? How do we promote the next generation? So I think it's one of the most vital careers that anybody could have. But I think it's up to us to see that it survives going forward, and that the people that come into it have the right attributes, the right skills, the right education to take it forward.
Do you think that the nursing as a profession that other professions are encroaching into the practice of nursing and probably removing the essentials. If you know, I mean, for example, like most doctors or gynecology, obstetricians, also they now want to deliver babies. They want to deliver babies even when there is no complications. How does that allow midwifery to evolve? Such things.
So I think nursing and midwifery will always evolve, because I think that skills evolve. So if you look at a lot of the things that nurses do today, they not only deliver babies, but actually deliver babies safely.
Exactly.
We have nurses that are practicing at advanced nurse practice level that you can't really differentiate between them and a registrar in terms of the capabilities and the things that they do. So the profession will evolve, because actually if you went back to, I don't know, early 1900s, for a nurse to do a blood pressure, a doctor would have said, well, that's my job. That is normal practice now for a nurse to do so many things that perhaps it was doctors that did at some time in the future. I think your point about, obstetrician wanting to deliver babies, well, for me, if an obstetrician doesn't know how to deliver a baby, he's not a very good obstetrician. So we have to ensure that some of the basic skills, so for me, if a nurse can't do the fundamentals of care, she's not going to understand, even if she's the highest trained nurse in the universe, the fundamentals of care inform nursing.
What are the fundamentals?
So basic things like how to show compassion, how to clinically assess someone, how do you know that somebody's really ill, what's your observation of someone. So what we used to call the activities of living and how we support them as nurses are absolutely essential for nursing care. However, most people now, I don't need to go in there in the morning and wash everybody, because actually that we shouldn't be detracting people from self-care. We should be supporting them when they need care. So we've almost altered some of the things that we used to do when we used to sort of get our bowls and go around and wash everybody. Now you're assessing, does somebody need that? No, actually he can do that himself, because we're not here to take away somebody's ability to self-determine. And I do believe that all of us, it is a bit of a field where we've all got to understand what the patient's needs are and respond to them. But we also need doctors. One of the saddest things I think would happen if obstetricians couldn't do a normal delivery, because they may need to be doing a normal delivery at some time. So I think it's essential, even with the midwives, when I worked with them, it's essential that everybody gets the right training, and we have to make that available for junior doctors or doctors in training. But actually, if a midwife does the run-of-the-mill birthing, I think that is absolutely essential, and that's how we've always come to know it. But we shouldn't be stopping junior doctors able to acquire the skills that they require to be able to take their profession forward. So I think it's a bit of both, if I'm trying to say really, is that we do need midwives to deliver normal babies, but if a doctor hasn't had the training, or a medical student hasn't been able to get that training because we've got too many midwives doing it and they won't let him do it, we have set a doctor off on a trail who might end up being an obstetrician that hasn't had normality. And then how do we expect them to know what normal is?
Yeah, exactly. So let me come back to your leadership now. Being the top woman in the profession in London, how would you describe your leadership style?
So one of the things I'd say about my particular style is I like coaching people. So of course one of the things that I'm really keen to do is make sure that I teach people how to be leaders, or facilitate them being leaders. So naturally I think it's about enabling nurses. One of the things I'd say about leadership in nursing is we have to allow junior nurses to become decision makers. It can't be the people at the top that make every decision.
Yeah.
And I guess for me, it's always been important, whether I've been working with nurses, doctors, changing an A&E to improve it, whatever I've been doing, is to get the buy-in from my colleagues, because actually it's only by them owning the problem that we can improve it. You know, I can talk about it as much as I want, and I can say we need to get to this level and that level, a bit like, you know, A&E targets. We can pronounce it as much as we want, but the people that can effect change are the people actually delivering that care on a day-to-day basis. So if I'm going to improve anything or work with people to get improvement, it's about having a coaching and a facilitative style and a good rationale about why we're doing it. So most nurses and doctors will do something if they feel it's improving patient care. If you can argue that what you're asking them to do benefits that patient in the bed, or the mother at home, or the baby that's being delivered, most of us come in the profession to do that very thing, to benefit our patients. And I think the fundamentals of what we have to hold as leaders is remembering when we became nurses, and actually that should be the rationale of how we improve the care, and how we make sure that all of what we're doing is about patients, not about governments, not about anything else. It is about how do we deliver that good patient care.
In the NHS now, do you think that the care that patients are getting are optimal, if I can put it that way? Like what you've described as what nursing should be and what it is. Is the system of NHS at the moment, is it giving nurses the opportunity to deliver that?
So I think the picture is patchy. But what we do know, because we know from patient experience, but what patients say themselves about hospitals or the care they've received is patchy. We have really good examples of good care, and that is when we've got the right amount of staff in a hospital, the good education, good systems to debrief staff and help staff analyse how they can improve. Those are the places that are delivering really, really good care. However, we know that there's a lot of hospitals or systems actually, so even if district nursing, that is under pressure, that is short of staff, people aren't giving you time to take out, you know, we know from some of our midwives that they go on duty, there's not enough staff to deliver, and those are when you get stresses in the system. So I think if we were, it depends, it's all relative, isn't it? I would hands on heart say the NHS is a fantastic system if you need emergency care. So if you get run over, they're not looking at the colour of your skin or how much you've got to pay. They will provide, having worked in an A&E, we will provide the best care that we can give. However, it is not the same for all parts of the NHS. So some people, when they're in outpatients, might have a very different experience. And we know that we won't improve the NHS until we improve all parts of the NHS. So it's tied up with many things. It's tied up with the education of nurses. It's tied up with, how people get engagement, or, if you stress somebody out continuously, then they become stressed all the way through. So for me, the temperature of how good a hospital treats its patient is the same temperature it uses to see how good it treats its staff. So if you treat staff well, often they treat patients well.
Well, exactly. Now, you've had a lot of experiences as a nurse, and you've climbed in your career. What do you think is the ingredients that made you to achieve the success you have achieved, both as a leader, as a nurse, in your career?
So I don't think I ever, in my entire life, ever thought I would have become a director of nursing when I started out in nursing. But I did enjoy nursing, and I think if you enjoy something, you want to be the best at it. And I also think people notice that. So, if you can somehow channel your energies to actually do the right thing, I think sometimes other people, not just patients, but other people that you work with, do notice that. I also think it's a bit of luck as well. So I think there are people that you will meet throughout your career that will support and help you if you know, for whatever reason, whether it's because they've seen you do something well, whether it's because you've spoken well at something. So I think it's a bit subject to a range of things. I wouldn't say that anybody ever does it all by themselves. There has to be a recognition that you have to persevere. There'll be many disappointments. There will be many things in my career that I thought I would want to give up on, and you know, many no's, many doors shut in my face that said, oh, you're not good enough, or you can't do that. So there has to be a bit of self-belief, personal belief, but also the enjoyment and the drive to do your job as well as you can. So it's never, for me, it's never been about, oh, I'm going to be whatever, because you know, a director of nursing or a dame or any of those things, but actually I have to enjoy the job I do. And the fortunate thing is that I ended up in a career that I really loved. So that was the starting point to be able to do it really well, because if you actually are happy in doing a career, even if it's, you know, hauling yourself off to do night duty, and you can find some enjoyment in that, then you usually can find some enjoyment in the rest of your career. But it does mean that you have to be ambitious. It does mean you will have to want to study, because you can't be there and not have the right knowledge base. Does mean that you have to take responsibility to develop yourself. And there is also, I think, and you know, for many nurses that I've worked with, you have to have the right attitude, because you can't be a leader lording it over others. You've got to be a leader that facilitates others, because you're not there forever. So if you can't help someone else pave their way, then you're only as good as you were as the last decision you made. But actually, if you can help someone pave their way in their career, that continues. I always think that's a legacy.
Okay, so what inspires you as a person?
What inspires me? I guess for me, inspiration comes, I really love to see people learning, or you know, people that come up with new ideas or looking at things differently. So throughout my nursing career, you could become quite processy in nursing, because there's always a tool to do everything, or a plan to do something in a particular way. I've always been inspired by looking at things really differently and thinking, can we do that differently or better? Can we improve that? So I guess there are people that inspires me. There are people that want to take a risk. I'm a bit of a risk taker. So they're the people that inspire me. It's not the humdrum that does everything in a particular way, but it's the people that actually look at something and think, actually, we may be able to just do this differently and better. So that inspires me. Young people inspire me always, because I think they're always seeing the world as you know, positive. Yes. And so often I think one of the best parts of my career was teaching young people, or young nurses or doctors or whatever. Always enjoyed teaching them, because actually they don't see the world the same as you. Our generation now, the way in which we nursed will have to change so dramatically, because they don't want to see someone face to face necessarily. They want to talk to us on YouTube or on you know, it's going to be a completely different world, because it'll be iPhone and messaging and iMessage for a diagnosis. It's going to be completely different. So I think we have to, for me, the inspiration is about how you see the future differently.
Why was it necessary? How do I put the question now to you? You read law, you know, as well as being a nurse. You also read law. Why did you do that?
Why did I do law? I guess it was a way of just explore. Law can be quite related to nursing in some ways, and it was about, I guess it was a personal test to me about whether I could read a subject like that, because as I said to you, I started out sort of bean counting, maths and things like that. So it was an interesting subject that I thought fitted with nursing, but particularly medical negligence, particularly child law, a lot of the aspects of law fitted with things that I hope to practice. But actually the inspiration for me doing law was I was a health visitor at the time, and I was walking the streets of Newham, and we had a huge immigrant influx at that time, where a number of my clients were stuffed in one room, so we would sometimes have 8 or 9 children, and apart from working overseas in Kenya, I'd never seen marasmus in the UK, but I saw it on the streets of Newham. And so the inspiration for me doing law was I was really, really upset about the 19-whatever year Housing Act that meant that people that came into the country often it was from Asian countries, were treated as being intentionally homeless. And I thought there must be something in the law that actually overrides that. So that was my motivation to go off and do law.
Oh, how lovely. So do you personally, in your personal view, do you recommend that nurses try as much as possible to study law?
I guess it's...
Will it help a nurse in their profession?
No, I guess the skills that you get from reading law is being able to analyse, being able to come to conclusions, being able to weigh up sides of the argument. So the law gave me a lot of my analytical and critical thinking and reasoning skills, and it contributed to my nursing. So I think that there are many degrees out there that you could do that could contribute to those, or could give you those skills that could contribute to nursing. For me, law was a particular interest because it had a lot of history, so some of the things around the Children's Act and some of the child law and lots of parts of law, contract even, is very historical, and I was interested in that. So for me it was about meeting my particular interests, but I don't think law, or a lot of what I've used in my later career was maths in terms of commissioning. It was always budgets, and I was director of commissioning and director of nursing, so it was all about sort of weighing up budgets, being able to contract, understanding how contracts work. So many of the things I guess that I studied in law or did in maths helped me in my nursing career. And I think many of the skills we acquire in life help us in whatever career we do.
Yeah, so what books do you read?
So I read a variety of books. I like thrillers and I like problem-solving books. So John Grisham is one of my authors that I read. I read anything and everything, depending on where I am. So I often don't read very much of literature while I'm working, but should I go on holiday, I can read up to 5 books. I like autobiographies, so I really like looking into the lives of others. I like sort of a variety of books. Sometimes I'm just reading for the sake of reading, but possibly as a child I grew up reading a lot and have always read a lot.
Who has been your role model?
In life? A variety of people, really. So I'm often, at my heartstrings, I'd say someone like Nelson Mandela. I just think the adversity that he's gone through. But there have been many, really. I think I had really good role models in my mother and father. In fact, they were quite, I wouldn't say pushy, but interested in you achieving. So although they were a bit laid back, I think my father was a bit of a philosopher, so he wasn't too keen on academia as much as most fathers would be, because he always felt the school of life was a better education.
So you becoming a dame, how was that for you?
Well, it was really amazing because quite an educated person, I didn't really know what a dame was. So I'd heard about them, but I really didn't know what it meant or what it was. And it's always been a really interesting story, because actually I was in America when it came through the post. And by the time I got back to England, the date for acceptance was almost up. So, and nobody had told me that there was a letter waiting for me. So, but when I opened it, I was just like, I was so shocked that I almost screamed. You're supposed to keep it very quiet. And my children, I live in quite a rough area, and they were like, "What's wrong, Mum? What's wrong?" Thinking that something had happened. And and I said to my son, I said, I don't really know what it is. So he got onto the computer and he said, "It's this, Mum." So it was an absolute thrill. Once you realise that it's such an honour, you think, well, how did I get that? Because I could never have envisioned as a young nurse starting on the steps of a London hospital that I would be a dame one day. It just doesn't enter your head, does it? So, and I don't know why, a young Hackney girl went to an ordinary school, went to a grammar school, but you'd never envision that someone's going to suddenly bestow this great award on you. But I do, I guess for me, the best thing about it was the expression on my children's face. They were like, "You've got to," they were so proud. I couldn't have been proud as they were. So it's just for me been a real sort of role model thing for my own children. I've got 3 children, and for them it was just astonishing. I've just seen them. My parents weren't alive when I got it, so that was a sadness for me because they never saw that, but they did see me become a director of nursing. So
that's good then. I think they saw a bit of me.
Yeah, a bit of me. Yeah.
Yeah, coming up and becoming the person that you are today. Yeah. How long have you been a nurse? 34 years. So in the next 3 decades, what are you going to be doing?
In the next 3 decades, I should be resting myself at home. I think I've worked hard for 33 years. So I think it's really, for me at the moment, the focus is really getting the standards of nursing and the practice of nursing the best it can be from the Royal College perspective. Future, I don't know, I think other things like flower arranging, easier things in life that are more aesthetic. But yeah, I guess for me at the moment it's focusing on improving the nursing policy and practice.
During your time, all this while as a nurse, from the junior nurse to the top nurse now, what memory lingers on?
Do you know, as a nurse, you always remember particular patients. I don't know about you, but I always have in my head particular patients or people that I've looked after. So, and it's often related to place. So, earlier this week I was in Lewisham, and I can remember working in Lewisham with several sexually abused children in clinics, and so there will always be memories of the people that you have looked after, supported. There'll be some good memories, there'll be some people that were pretty offensive to you, but you kind of help them get over that hurdle. And the other thing is good professionals that you've worked with, good doctors, good memories of working with some outstanding doctors and nurses in my lifetime that have really made a difference to somebody's life.
You picked the case of there was a child one time that was it
Victoria Climbie?
Victoria, yeah. Why did you pick particular interest in that case?
So I was called by the government to represent nursing on that inquiry. Okay. So I was asked to do it. It wasn't something that I wanted to do because it was such a sad case. Yeah. But it was something that I had the skills to do to work through that case and that young person. So I think in 2000 I got called to do that inquiry, which meant that it was looking over what we could have done as the NHS, as social care, better for that particular child to prevent her dying. So it wasn't a choice, but it was something that will forever stay with me. I learned so much about how we could improve our services.
What does life mean to you?
Happiness. I equate life with happiness. I love life. So it's about for me it's about doing the best you can in whatever you're doing. It's about making sure that you live happiness and spread happiness. So that's what life means to me.
And my final question, what is most important to you? in your life?
Do you know, the most important thing in life is the people. So it's the relationships we have with our children, our partners, our people we work with. So for me, it's about, do I have good relationships? Do I leave somebody feeling better after they've met me?
Thank you so much. This is, I'm so inspired by, talking to you. Honestly, when I started as a nurse, or in Nigeria as a nurse, you can't sit down like this with, the director of nursing. So it's been a pleasure to meet you in person, and you accepting the Legend Award from CNC Magazine, because we really appreciate you, and I'm not disappointed at all meeting you in real life. And I hope that you get one or two things, inspiring you to move to the next level. And that is all from us today from Faunteeshow. Keep watching. Thank you.